Choosing a Medicare plan is a big decision, and it may feel like you are married to the Medicare health plan that you chose at the youthful age of 65 years old. And you might even find that your situation has changed. Your plan has changed, or it's just not the right fit anymore. So what can you do? Well, obviously you can change your plan, but there are some rules about it. Now, this is Michael's Medicare, where we talk about all things Medicare, from plans to benefits to enrollment periods, extra help, prescriptions, drug coverage, and Medigap, and really the whole kit and caboodle that is Medicare. But before we get to it, please don't forget to like and subscribe, because it will help keep you up to date about the newest Medicare changes, options, and ways to make more better informed Medicare decisions. All right, here we go. So like I said in the beginning, choosing a Medicare plan is sort of like blind dating, because you don't really know what you're getting into until you are halfway through the main course. And sometimes by then you realize that perhaps you should have chosen a different plan. Or maybe your doctor isn't on the plan anymore. Or maybe the hospitals aren't right. Or maybe you didn't realize how much it would cost to see that specialist, or maybe even your monthly premiums are just getting too much. All these things would be a good cause to change your Medicare health plan, but Medicare isn't like the trolley in San Francisco where you can just hop on and then hop off. There are really only specific times that you can change or drop or move your plan, and you have to do it during one of the various enrollment periods. The first and easiest enrollment period is when someone first becomes eligible for a Medicare health plan, usually when they turn 65 years old, perhaps even younger if they have specific illnesses like end-stage renal disease or ALS, or maybe if they are disabled. But either way, when someone first gets their Medicare card, it'll have dates on it that will show the eligibility for both Medicare Part A and Part B and when they start. Whenever those dates are will be when your initial coverage election period, or ICEP. It is a period that lasts for 7 months, 3 months before your birthday, the month of your birthday, and then 3 more months after that. So a totality of 7, at which point you can choose once a Medicare health plan. If you choose a health plan before your birth month, because you're an early bird, then your plan will start the first day of your birth month. If you choose a plan 3 months after or during your birth month, then that plan will begin the following month, the first of the following month. Once you make your initial selection for your ICP, that's when it ends. And you can't make any more changes unless you qualify for another election period. The most common election period after the ICEP is something called the AEP, or the Annual Election Period. This happens every year from October 15th through December 7th, and during AEP, you can change your Medicare health plan. And in fact, you can change it as many times as you like, with the last selection being the one that sticks and starts as of January 1st. Initially, you can drop your Medicare health plan altogether, or you can go back to original Medicare and usually pick up a prescription drug plan or a Part D plan as well, just to make sure you got all your bases covered. And again, any choices that you make during this time period will go into effect as of January 1st. This AEP happens every single year at the same exact time, so it's important to look at your Medicare options during AEP, because Medicare Advantage plans or Medicare health plans or even Medicare prescription drug plans or even Medigap plans, they can change every single year, and prices go up, sometimes prices go down, doctors' networks change, benefits can change, and you can change for that matter. And that all has to be kind of weighed out against the options that are available for the future year. So let's say you choose a plan during AP and it starts as of January, and you try to go use your Medicare plan and you find out that your doctors don't take it, or your medications are way more expensive than they ever were before. This next election period that I'm going to talk about, known as the GEP, or the General Election Period, is a one-time shot that if you enrolled into a Medicare plan during AEP and you don't like it, you can switch to another plan once. Also, you don't hear much about this in the advertising and the marketing, by those good folks like Joe Namath on TV, because it's not a time that Medicare beneficiaries can be marketed to. It's just more of a mulligan or an oopsie that allows you to go to another plan, or maybe even go back to your previous plan that may fit you better. This period runs from January 1st through March 31st every year, and if you use the election period, then your plan will start at the beginning of the following month. So those are the main yearly habitual enrollment periods. There's ICEP for the newest folks just coming into Medicare. There's AEP for folks who are already in Medicare but want to make changes. And then there is the GEP for folks who made a plan change, found out they didn't like it, or they didn't like that new plan, and it wasn't a good fit, and then went back to change to a different plan just once. And in most cases, unless you have a special enrollment period or an SEP, then someone might actually be stuck on that plan for the remainder of the year until AEP comes back around in October, when they can use another plan that, again, won't start till January 1st. But the asterisk to this is someone who is eligible for the various and sundry SEPs that are available. And I'm not going to cover all of them because there are many, many, many different SEPs, but the main ones I'm going to talk about will allow someone to make a change to their Medicare plan during the year if they qualify. The first and probably one of the biggest SEPs is going to be for Medicare beneficiaries who also qualify for the Medicaid program, which is your state's low-income health insurance, which is possible to have both Medicare and Medicaid at the same time, or as it's called, Medi-Medi. I know, a little on the nose. Or perhaps qualify for some of the other income-based programs that help seniors, like low-income subsidy programs, or LAS, or sometimes called extra help. But if someone is in one of these types of programs and also in Medicare, they will have an SEP through most of the year in which they're able to change their health plans once every 3 months or once a quarter, with the exception of the final quarter, Q4 of the year, which is, of course, AEP. Previously, folks enrolled in both Medi-Cal and Medicare, they actually could change every single month, but needless to say, that got very, very messy very, very quick. Now, another SEP is for someone who moves out of the service area in which their Medicare health plan is zoned, which is generally the county that someone lives in. So if someone moves out of that area, they will have an SEP to choose a plan that does service the new area of their new residence. But this has to be a real move. You can't just go visit Aunt Griselda and call it a move. So it needs to be a permanent total move. Let's see. So I guess another one would be if a person is moving in or out of an institution like a nursing home or a skilled nursing care facility. Coming in or out of those would also qualify as an SEP. Oh, a big one is for folks who are already eligible for Medicare but are coming out of an employer or union coverage. So this one is really important to understand because essentially if you are eligible for Medicare and you're going to be losing your insurance from an employer or perhaps from a spouse's employer, then you will qualify for an SEP even after you turn 65 years old and get outside of that ICEP age range. Basically, at any point in time you lose credible work coverage, and credible is the key word there, then it is possible to elect to enroll into a Medicare health plan without any penalty or having to wait until the annual election period in October. So that is the gist of the SEPs. There are way, way more SEPs, and we're going to get a chance to cover a lot more of those in depth in some future videos, specifically centered around Medicare special enrollment periods. But the important thing to consider right now is that if you are unsure if you can change or cannot, contact a professional. That could be Social Security office, that could be Medicare, that could be a trusted agent, that could be a navigator, that could be some of the nonprofit organizations, or even Medicare.gov on the website. There's a lot of great information out there. So that's going to be it for today for Michael's Medicare. And if you have additional questions or you want to get more information about your specific situation, feel free to reach out to us at the info below in the comments, or give us a call, or check out our other great videos on the YouTube, on the socials, on the Instagram at Michael's Medicare. So for Michael's Medicare, I'm Michael, saying thank you and